So tell me this. You got your bachelor's in sociology. You're coming out of undergrad. You're saying, I'm definitely going back home. Thanks for the help that you wanted to give me, parents. So you go back home. You're a public health quality coordinator at the Commonwealth Healthcare Corporation in
Yeah,
Saipan, North Mariana Islands. When did you know about public health before applying for this job? Were they just jobs that you were applying for and you ended up landing in this job? How did all that happen?
yeah, no. So I came home and like getting a job was like a little bit more difficult than I realized, but I now realize that when they're telling you what the American dream is, or I don't know if it's the American dream or just like any dream to keep kids going to school, but they just say like this is supposed to help you get a land a job. Nobody's landing anything. You still have to. What they don't tell you is that you still have to put in work, and you gotta like then make it your second test to like, is this something that really interests you? And truthfully, when I first moved home, I was applying for jobs in our school system. I wanted to be a counselor, actually. Uh, and then there were some things that didn't work out there. And then um, I had like a little bit of a stint, just I needed a job. I needed to get some money in my pocket. And like, I think just like my first experience at like a job after college. So I did some like work at a private clinic, and that was like started to like spark my interest because I was like, oh, I like talking to people and like serving them, but like I'm not the one that's solving all their problems or like giving the prescription to what their problems are. Which I think is the sociology part of my interest. And around that time, like I saw this, um, I got the opportunity to work as a public health quality coordinator, and I didn't have the full understanding of public health was. I thought growing up, public health just meant the health system. It meant the hospital. You know, it meant like who you see to feel better. So I didn't understand like, oh my God, like how big of a spectrum. But I will tell you what I did do. I definitely did Google it, and I was like, oh my God. Like I think it was like my first time I ever saw like the Centers of Public Health, like how far it spans, and all of that. I was like, that's interesting. And from there, there was like a little bit of a spark. And then when I got into my role for public health quality coordination, I had to work with all the programs. So I literally had to sit down and interview each program and kind of give them, I guess what would be like almost like a podcast interview now of like, what do you do? Like, what does your program do? What do you do for the people? Like, what's your goals? And all of that. And so it gave me a better understanding of like how solid public health is, truthfully, and what part it held in our health system. And like, it was from that I was like, oh, this interests me so much. Like, I love how they get into the community. I love how all of their stories and all their results are tied to people, whether no matter what you look like, no matter if you have $1 in your pocket or you have $100 in your pocket. Like, I love that, and I guess it again, it ties into like, feel like there's so much conversation, and I don't know if that's tied to my not liking to be lonely, but I feel like public health is such an open, vibrant space. And yeah.
No, I appreciate that. And that is definitely, I feel like the questioning that goes into many people's head is like, oh, I don't know what public health is. And you learn about public health. And then you're like, okay, I kind of understand what it is. But then you're like, oh, now I know that there's so much more in public health. And then it's
Yeah.
just trying to figure out like what you want to do in all of that. And so tell me a little bit more about what you did in this role. And I know that you also shifted or got promoted into a corporate quality performance manager role.
Yeah. So around the time when I started was like in public health was like the space for like quality improvement, performance management, and accreditation. And so that like the public health quality coordinator was like handling. It was like getting people to do reporting that wasn't just for your grantor, being able to like look at metrics, like putting, it was like really starting the performance management button for public health. Because I think, and I don't know if this is, I think it is. I think I've had enough conversations where it's drivers in the main, like you report a lot to your grantor because that's tied to financials, right? But are you invested in like learning how well you're performing to self improve your program? And truthfully, it was set up in a system where, I explained earlier how like we live in like in a it's not a duplex, it's a triplex, right? It's behavioral health, public health in the hospital. In the hospital, those standards are set, they've been set for years. They're tied to like Medicaid and Medicare, and so they have quantity reportings. So that's something that all the units and programs in that house are used to. So it was just implementing it into public health and having all of the programs, choose some metrics that were really important to them that aligned with things that were of priority to public health. And, like going over those reports and it's not just for the higher ups and it's not just for the managers, but having the staff be able to understand that and, get into the groove of like putting in the numbers and then making changes if needed. And if not, learning how to be consistent in a habit and being able to go say it's okay, we can look into something else that may be of challenge, or even the culture of change. I think that is hard, like in general, and like we use public health quality to be kind of a driver for that. Because creature of habit, right? Creature of comfort. Why am I going to fix something that I don't feel is broken? Or like, how do you know that it's not broken? And also, how then do you go into a space of innovation and changing and being one step ahead for like your health system and your people eventually?